Good afternoon, everybody. Welcome to today, Monday's 4 p.m. COVID update. To give you a preview, things continue to move in the right direction and moving there quickly. Last week, when we get to the week comparisons, was our lowest number of cases in 11 weeks. We're down from 30,000 cases to about 9,700. But remember, that's up from about 1,200 cases in the summer when we got to our best place in a while in battling COVID. We're under 1,000 Kentuckians hospitalized now, and we hope that continues to decrease. And we are now under 6% on our positivity rate. So let's start with the numbers from the weekend. On Saturday, as our highest number of cases for the 3 days we're reporting, 1,275. Also, unfortunately, 30 new deaths. Remember, deaths follow cases. And they included 4 Hardin County deaths, 3 from October, 1 from September, 1 man who was 30 years old. Sunday, 803 new cases, 28 deaths. They included a number of younger Kentuckians, a 33-year-old man from Kenton County, a 48-year-old woman from Pike County, and a 43-year-old woman from Pulaski County. Remember, the Delta variant is not just sickening younger people, it is killing them. So you need to get your vaccine. Monday, hard to remember days that were this low, 544 new cases. We've had days a lot lower than that, but it's been a little while. 23 new deaths, including a 49-year-old man from Bullock County. Our current positivity rate, 5.84%. Kentuckians currently hospitalized, 919. And remember, sometimes it ticks up a little on Tuesday because of reporting over the weekend, but then the trend, is always continued down. 281 Kentuckians currently in the ICU, 157 on a ventilator. As you'll see in a moment, those are all continuing positive trends, which means they are decreasing in this instance. Let's look at our stair-stepper chart. We are almost decreasing in cases at the speed that we increased. That is a very good sign. Obviously, we went through exponential growth in cases, and that's led to significant loss of life that we're still seeing on our reports. But the decrease is a very good sign. Once again, it's the lowest in 11 weeks. But still, if you look at where it is at that 9,749, that looks good when you compare it to 30,680. But look at how much higher it still is than just about any week we had before that really tough period in the fall and in the winter of last year, and then the most recent just devastating period that we are hopefully coming out of. Again, trending in the right direction. We've gotten down to just over 1,000 cases in the summer, which was a very good place to be. That should be our goal again, is to get to a place where COVID is that there are many fewer cases. Positivity rate, which remember is a leading indicator. Case is a bit of a lagging indicator, though our cases are now reported closer in time than they were in the past. You can see also a positively negative trend. That it is very positive for us that the positivity rate is falling, and it is falling pretty quickly. Admittedly, it's falling more quickly than we anticipated. Inpatient census for Kentucky hospitals. Remember, we want as strong of a downward slope as possible. That looks pretty good. We are now below and maybe even significantly below where we were at the height of the fall and the winter surge, though we still have a ways to go to get where we were in our better times during the course of this pandemic. But again, this is good. right? It's good. The decrease is real. It is continuing. We see that in the ICU as well, where we are very fortunate it's decreasing. So this is decreasing a little slower than the number of cases. We think that's because of how sick the Delta variant makes people. But the trend is similar in cases in that it is decreasing. And then Kentuckians on a ventilator. It was until the Alpha variant, we had some Kentuckians on a ventilator, and then we had that spike during the fall and the winter. But look at how much deadlier or how much sicker the Delta variant made people than the Alpha. Also, how many people it infected, how quickly. But again, that continues to decrease at a very significant rate. Vaccination status of cases, hospitalizations, and deaths. This is holding pretty steady. Again, 85% of all cases. And remember, you can test positive and not be sick. You can have COVID, but not be ill or not have significant effects from it. So 85% shows you can still get the Delta variant if you're vaccinated. You could still spread it. But then you go down, especially to hospitalizations. Again, about 92% of all hospitalizations are unvaccinated individuals. And then deaths, 82% of all deaths, unvaccinated individuals. But this is what brings us back to boosters. And I'll talk a little bit about kids and boosters. But if you are over 65, you need to have a booster. Now, you could have taken any of the shots and you need to get your booster. The Moderna booster is ready, available. Pfizer booster, ready, available if you're over 65. If you took J&J, you need to talk to your doctor about whether you should take a different booster. In other words, Moderna or Pfizer, which they're now allowing, or go ahead and get the other J&J. A lot of these deaths are from individuals over 65 or part 2 of boosters. If you have significant underlying conditions, you can now get any of the boosters. So again, if you're over 65, if you have a serious underlying condition, or if you're exposed to a whole lot of people through your work, now, no matter what no matter what vaccine you got, you can get a booster. I want to go over that one more time. Over 65, have an underlying condition, or have a job that exposes you to a lot of people, go get your booster. Now, there's just one more piece to that. If you got J&J, go get a booster. Doesn't matter how old if you got it. Doesn't matter what your job is. If you got J&J, go get your booster. Go get it now. I would act with some urgency in all this. I would act with more urgency if you got J&J and Pfizer, because we believe there are more breakthroughs there. But if you got Moderna and you fall in any of those categories, go get your booster. We believe that will change these death numbers, breakthroughs to the better, with much better protection. Our hospital report, things are getting better. COVID hospitalizations have decreased 20% over the last 7 days in our rolling average. 171 ICU beds available. Again, that's floated, but it hasn't gotten nearly where it was when we were most concerned. 53 hospitals continue to report critical staffing shortages. 11 children hospitalized with COVID, 3 in an ICU, 2 on a ventilator. We'd like to see that number reach 0. All right, COVID-19 vaccines for 5 to 11-year-olds. One of the most exciting topics to me, a dad of an 11-year-old. I've been waiting on the news for the vaccine to be approved since COVID hit, or since we knew there would be vaccines. Like so many other families, I am so eager for my daughter to be able to get her vaccine because I know they're safe. I know they're effective. I love my wife. I love my kids more than anything, more than this job. Would have never, ever recommended to them or gone with them. I went with my son to get his second shot. If I didn't know that they are safe and they are effective. They are safe for you. They are safe for your children, and they can lead us to that better world. I hope just not back to normal. I hope we're a little better after what we've experienced. And looks like kids won't have to wait much longer. An advisory panel of the FDA is scheduled to meet tomorrow to consider Pfizer's application for children 5 to 11. Remember, this FDA advisory panel meets, eventually makes a recommendation, and then it goes back to the CDC, and then ultimately up to the director of the CDC. We expect they will be authorized. In fact, they're already being shipped so that they're ready. That it's normally the day after they're authorized. Remember, Dr. Stack walked through. These are not just less of the adult vaccine. Remember, it's only Pfizer for 5 to 11-year-olds that's looking at being authorized. And they have to package it differently. You cannot use an adult vial to give a child 5 to 11 a vaccine. The kids are going to be, I believe, in the orange vials, whereas the parents are in the purple. So when you take your children in, and we'll show that again on Thursday, it won't be fully authorized by Thursday, but we'll show, or if it is, that's a great thing. But we will get that out to make sure everybody sees what it looks like, so you can be sure when you are taking your kid in. So I think it's only weeks away. I hope it's less than weeks away. It'd be really exciting if we could get many of our kids vaccinated, especially before Christmas, when I know people want to get together like they did in 2019. All right, today we're going to hear from Rebecca Dutch, PhD professor at the University of Kentucky College of Medicine, who will answer why it's so important for those eligible to receive a COVID vaccine booster. As we shared last week, in addition to Pfizer, Moderna and J&J boosters are now approved following the CDC's decision last Thursday. If you'd like to learn more about booster eligibility, we went over it, but you can also go to kycovid19.ky.gov.
So what they're seeing now is that over time, your immune response to the vaccine that you got is slowly decreasing. Now, if you look, for instance, at the Pfizer vaccine, you're seeing a decrease in protection from getting COVID, but very little decrease in your protection from hospitalizations. You're still very, very protected against severe COVID and hospitalization. But you're more likely now than you would have been 7 to 8 months ago to get COVID itself. And so to decrease those chances, what they're recommending is that certain groups of people go ahead and get a booster right now. What that will do is basically give your immune system another chance to see the thing they're going to respond to and up their response level. So it's a protective mechanism.
Next, we're going to hear from a number of participants from St. Stephen's Church. This church is doing their part to fight the war on COVID-19 by hosting multiple vaccine clinics, but I believe you're going to hear about one in Louisville. Today, we'll hear from my friend, Reverend Dr. Kevin Cosby, senior pastor at the church, and Erica Geddes, a doctor of internal medicine at U of L Health, who are going to discuss the statistics on vaccine numbers and how important it is that we do our part to fight this virus. Vaccine recipients Gary and Tyrone Daniels will also share their stories with COVID and why they decided to get vaccinated.
You need good health, and if we're really concerned about our people, then we're going to do what we can to help our people stay safe and healthy. And this vaccination is so important. And also because the church, especially for the Black community, has always been the hub and center of activities in the Black community.
I had double pneumonia in October. I almost died from that. So I was going to make sure I was going to take this Pfizer shot.
The majority of the shots that I've seen given today actually have been more of the boosters, the populations, a couple of first dose vaccinations. So that's exciting to go ahead and start that trial to say, hey, you're now on board to have your immunity there in that 90th percentile.
I think it's important for people to be vaccinated so that we can get this pandemic that we're in eradicated, at least get it down to where we can handle it.
The Christian faith is a thinking person's faith. Jesus said, love the Lord your God with all your heart, your soul, your mind. So we should use the cerebral gifts that God has endowed us with to find out what is the best health practices to keep us safe during this pandemic. And according to the science, which I'm confident, have confidence in, the vaccination is the best thing to do.
Speaking of vaccinations, over the weekend, 7,685 new vaccines. It does appear that we may be slowing a bit in pace, but that is to be expected. We're going to wait to go through the demographic breakthrough on Thursday, when we hope to have final and as accurate as we can numbers. So what we believe to be the case, and again, we'll be able to go over final numbers on Thursday, is that one of the major chains was entering data in two different ways, resulting in duplications that wasn't caught in the federal system. What we think that could mean is up to a couple 100,000 first doses being duplications in our numbers, potentially up to 5% of our overall numbers, maybe even close to 6% being duplications. Again, that's not something anybody wants to see, and we'll get the final numbers on Thursday, because we believe that there are some individuals not included at the moment too, but it's just important that we are accurate and we are transparent. We don't believe it'll change our positioning as opposed to our neighbors, but that's not what's important. What's important is how many of our people are vaccinated. And it just means we got to work harder. If we can get a more accurate number, we know how many more people and where still need to get vaccinated, and we will go and do the work. I also want to remind Kentuckians today that FEMA is providing financial assistance for those families hit the very hardest by COVID. We've seen a whole lot of deaths these past couple of weeks, and death is already hard enough, and the funeral expenses on top of it can be enough to hit the living, the families, even harder. So I want to remind everybody that FEMA is willing to pay some of those costs for you if you have gone through this. It's funeral expenses incurred after January 20th of 2020, so it ought to include all COVID deaths. It's part of the Coronavirus Response and Relief Supplemental Appropriations Act of 2021 and the American Rescue Plan Act. Expenses that qualify for reimbursement: transportation for up to 2 people to identify the deceased individual, transfer of remains, a casket or an urn, the burial plot or cremation niche, a marker or a headstone, clergy or the other officiant services, and the arrangement of a funeral ceremony, the use of funeral home equipment or staff, cremation or internment costs, costs associated with producing multiple death certificates. So just about everything that goes on around that funeral of your loved one, you can apply to get reimbursed. And I know that might be hard, and it should be your decision if you've already gone through this, if you want to apply for those funds. But I want you to know that they're there. And if you're already struggling and you struggled more to do right by your loved one, please take advantage of this program and let the federal government lessen some of the financial burden that you face. So to be eligible, the death has to have occurred in the United States. The death certificate must indicate the death was attributed to or caused by COVID-19. That's just one of the causes that are listed. And the applicant must be a U.S. citizen. The applicant has to be a U.S. citizen, but that doesn't mean the deceased has to be a U.S. citizen. So in other words, if you're a U.S. citizen with a foreign-born parent, say, who didn't become a U.S. citizen and passed away here in the States due to COVID, you can apply. We lost more than 9,000 Kentuckians. And so far, the families of about 4,300 have registered for this assistance. So a lot of people are going through the process. Of those, 2,500 have received assistance for a total of more than $18 million. If the applicant has all the required documentation, it only takes about 20 days to get the funding. So for everybody who's lost somebody, I know that's hard, but it's there. And I will say we have some incredibly strong people out there. At SOAR, I talked to a lady that I've known a little bit for a while who had lost her husband to COVID. And painful for her to talk about, but this was somebody that had to go through this whole process and hopefully has considered making this application. And you can always lean on friends and other members of your family to help you do it. I know everybody out there wants to help. It's why they lit their homes up green. It's why they did so many things during this. So if you need to get through filling out something like that, lean on other people. They want to help. All right, as another update on things getting better. Remember when we were getting overwhelmed, we requested 5 FEMA EMS strike teams to help transfer and transport COVID-19 patients. Each team consisted of 5 ambulances, and they were assigned across the state. The teams made a noticeable impact since their arrival, easing the strain on Kentucky's hospitals. Today, we thank FEMA and those who worked on these teams because yesterday was their last day of service. They are now headed to other places that need them more at the moment. We appreciate them. They ended up helping with 2,191 transport requests. They actually transported 1,957 actual patients. They drove more than 70,915 miles with patients on board, and they represented crews from 14 different states. These are people from outside Kentucky pitching in to help us in our hour of need. Thank you to FEMA. Thank you to those individuals who left their families to come help ours for that period of time. And finally, just 2 other quick things. One, August 2021, neat statistic outside of COVID, we had the 5th highest hiring rate in the country. That meant that people are finding jobs, though I know we need them to find them faster. At 5.5% is exciting. There's a lot going on in our labor market. We are laser focused on it and on different things that we can do differently moving into the future. Workforce development is going to have to change and evolve in how we go about it. With the boomers retiring, with our level of disability, with challenges in childcare, this is a time where we have to think differently and do more. But this is a really good sign. And what we're seeing, whether it's through our announcements, whether it's through creation of new jobs, is employers appear to see Kentucky as a place where they are more likely to get the workforce hired that they need. I think that's one of the reasons that they are betting on us. Last, I was asked for an update the last time on my request to legislative leaders for members to join a working group to talk about hero pay. My plan to provide $400 million to healthcare heroes and everybody else, those in manufacturing that worked all the way through, our police, our firefighters, our grocery store workers, and so many others. The Democratic caucus in the House and the Senate sent us names on Friday. The Republican majority of each said no, thank you. It's certainly something I wish that they would have been willing to do. If you rewind when these same individuals were saying I did not consult them enough during COVID, my response was, we went through the normal process. We testified more than 70 times at committees, and the response was, no, we're looking for a different type of consultation. Well, here we openly said, let's form a group, let's consult, let's make those decisions together. And the letter we got said, you can go through our committee process. So it may say something about what type of politics was been playing then or now, but we are still going to move forward. I believe strongly that our people who've worked almost 2 years through this pandemic deserve appreciation, deserve encouragement, deserve an attaboy and an attagirl. And this can be an incentive for people to hold on. So we're going to move forward in working with the parts of the legislature that are willing to work with us on trying to define the categories for it, the amounts for it. We look forward to hearing from the different groups. And as part of that, we want you to be able to tell your story about the amazing work that you did during the pandemic. You know, all too often we talk about the same groups, and it's understandable. If we're talking about healthcare groups, it's because they're helping really sick people. But you may have been working in a manufacturing facility that stopped doing the thing that makes your company money and started making masks or other forms of PPE. And that's really incredible. It could have been at the tough moments where you were the only person on the road going to a grocery store. So when that person came in, you know, there was food on the shelves. You could be that truck driver that was taking absolutely necessary supplies across the country at a dangerous time when we didn't know who could get infected and when. You could be one of the utility workers that made sure that power was getting to our homes. Be one of our social workers that was still going out on calls because you knew children were in danger. We want to make sure that as this pandemic hopefully is coming to a close, that we reward you as one Kentucky for the amazing things that you have done and for the courage you've had, and that you get a chance to tell the rest of Kentucky your story. I look forward to listening and to trying to hear and to celebrating that work. All right, we'll move to questions. We have 3 journalists here with us, about 5 on the phone. We'll start with Chad Hedrick from WKYT.
Governor, going back to the job numbers that you just showed, a recent report from the U.S. Bureau of Labor shows Kentucky has the highest rate of people quitting their jobs, and in turn also shows that we have the second highest rate for job openings. So we've got these numbers that you were just showing, and then kind of a downward. So can you just talk about
so
Kentucky as a whole?
So our challenges in the labor market are complex. Some folks, remember, just wanted to say it was about unemployment and the unemployment pay. You can't get unemployment if you quit. So when you're thinking about quits, there's something more complicated there that's going on. It may be that people are looking for a different environment. It may be other jobs have opened up. It's going to require that the private sector get a little creative, and also in many instances try to improve conditions, maybe even pay. But I can break it down. So we had a hiring rate of 5.5%, which was the 5th highest in the nation. The quit rate was a full point below that at 4.5%. Remember, we're talking about the same overall numbers that these are a percentage of. So the number of hires in the Commonwealth outpaced quits by 19,000. And at 5.5%, our hiring rate is 1.2 percentage points higher than the rest of the U.S. So we've got some good things going on. We also have some things that are very similar to what's going on in the rest of the country. Now, it does make sense that if we have more jobs opening up, there will be some people who ultimately move jobs, and you can only move a job by quitting or getting fired. But in this instance, the voluntary move. So again, we're going through a major period of transition, and none of it is simple. But there's some really good things going on right now, and I think people ought to feel more hope than concern. But knowing that, you know, even in a time of excitement, there are challenges out there. Now, with all the job openings and the rest, it's also a wonderful time to move to Kentucky, to have more opportunities here, and we're really starting to see that. When was the last time our hiring in a month was 1.2% over the rest of the country? So pretty neat to see Kentucky in the highlighted area in that. Tom Latek.
Oh, thank you, Governor. Good afternoon to you. I've got 2, and they're kind of clarifications on what you've already spoken about. One of them is on the FEMA funeral money.
Yes.
Is there an income limit or anything like that for people to apply, or can anyone apply for those benefits? And is there a ceiling?
So there is a ceiling. I don't have it in my notes about the amount that you can secure. I know that is in there, and let us get you the information on whether there is an income level. I don't remember that from the original report that came out.
Okay. And my second question, if you would, on the vaccine numbers that you said the state has that are wrong, are you going to just toss the state numbers and then go totally with the federal numbers?
So we're already
back, or
we're already totally with the federal numbers. This has occurred since we moved to the federal numbers. So this is about how reporting has come into the federal database, and then the federal database correcting itself. I mean, this is a massive undertaking. We want it to be right all the time, but it's a massive undertaking with every state tracking hundreds of millions of vaccines. Yeah, and I think we will be able to get it down to somewhere between 10 and 20,000 total vaccinations on accuracy, and be able to go through how we believe it happened. But the numbers aren't firm even as of today, but we'll give you the best we've got by Thursday. Mike Valenti.
Question on the work that's underway to enhance security between Capitol and Annex.
Mhm.
How do you believe this will improve safety? And I'm curious, did the insurrection on January 6th serve as a catalyst in any way?
So after 9/11, if we can go all the way back, the federal agencies, FBI, I believe Secret Service too, made two major recommendations for our Capitol grounds. Number one, to put a fence around the governor's mansion. And number two, to close just the section of road, the loop, that is between the Capitol and the Annex. And what have we seen since? Even recently, we have seen people drive their cars through demonstrators, which we have lots of demonstrations, I would know, behind the Capitol. And so when you talk about protecting people's First Amendment rights, we think this does it. We think it protects their safety during that. We've seen a car bomb as close as Nashville, right, going off and impacting the grid. The ability, if that's not blocked off, for someone to even drive their car up into the Capitol or into the Annex before people can react wouldn't be very challenging for someone to do. We saw with people going past all the barriers at the governor's mansion early in COVID. One of the rationales for those recommendations right there, and certainly the January 6th insurrection, how it's come to light, how many different anti-government groups there are out there, the level of domestic terrorism, all come together. But it comes down to this for me. I'm not going to be the governor who failed to act and people got hurt. I'm not going to be the governor that fails to put up the bollards and close that section of road, even if it creates an inconvenience and that ultimately costs people their lives. I can't go back in time with other people's decision to do or not to do something. I can just look at my responsibility, and I think we're serving it. Now, we only heard from a few legislators, most, and certainly the security, I think all got it. And I think in time, because immediate change gets everybody in time, the concept of having an entire green space for any type of, it doesn't have to be a demonstration, it could be a festival here in Frankfurt, it could be so many different things. It's going to be really exciting. It's going to give them more campus feel, I think, between the Annex and the Capitol. And who knows, maybe a campus feel will improve relations at different times. We can all talk outside where it's sunny. Maybe it'll bring out our better nature. Sarah Ladd, the Courier-Journal.
Yes, thank you. Could we get an update on the memorial that's planned for going up there at the Capitol to recognize those who died from COVID, please? Thank you.
Yes, it's now down to, I think, 5 proposals that have been sent to the committee that we put together. Those were people that asked to be a part of it, that sent in their names and their story. They have a kind of a series of questions to look at each one and give their genuine, authentic response to. We will then take those and ultimately be able to make a final selection. The artists that submitted have been advised if they're in those last 5 or not. We've had major hospital systems primarily step up and agree to help fund it. We believe we now have the private sector funding necessary to move forward with it. I've seen the 5. Am I right, Scotty? It's 5. The 5, and all of them would be special. But I really want to hear from those that have been impacted even more so than I have by COVID. You know, how does it make them feel about their work, say as an ER doc on the front lines? How does it make them feel as a person who lost somebody? We want to make sure we take and we process all of that to ultimately come up with a decision that is the most meaningful to the majority of people. The location is also already set, though it can be moved just a little bit. We actually have a monument park here on the Capitol grounds. You can only see one of those from the road. That is a Gold Star Memorial. So as you come up to the Capitol and go to the right, it's on that side. This one will be closer to the parking lot. So on the almost the end, if you're starting at the front of the Capitol on Monument Park. Karen Czar, WUKY. Okay. We'll come back to Karen. There you are.
Apologies, I'm having trouble with my feed on my end. If this has already been asked, you can go ahead and move on and I can back up the feed. But do you have an indication as to how successful and how receptive Kentuckians are being to the boosters? And do you know if we are losing any supplies because of shelf life with the Pfizer in particular? Thank you so much.
So we certainly lose supplies, not necessarily because of shelf life, but the federal government gave us the go-ahead that if you've got 2 people that are ready to get vaccinated, go ahead and vaccinate them, even if that means you break the seal and certain vaccines go unused. We believe that is the primary cause of certain doses that are unused. I don't want to say they're wasted because I don't believe that's the case. It's different now than when we had people lined up out the door where you could make sure every single dose was used. Now it's so important with the Delta variant to get that vaccine in people's arms. I haven't seen the statistics on the 3rd dose yet on the booster. That's something that we can work on getting, but I think you when you back it up, you'll see in the St. Stephen video, they were talking about the majority of people that came to their clinic being booster doses, booster recipients. Anecdotally, hearing a whole lot of people getting their boosters. I do think it's people over 65 that we're having the best success with, and they're also the most vaccinated group. I think some of the professions and maybe some of the underlying conditions, though anecdotally, we think that those folks are going in. They know they need it. But certainly forward-facing professions, I think, will have more to do. Melissa Patrick, Kentucky Health News.
Hi, Governor. So Kentucky has a higher rate of cases than the national average, but appears to be have a better rate around deaths, just below the national average. I was just curious if there's a reason for that, or if you can kind of expand on a reason for that possibly.
Well, I think there are a number of reasons. I think that while we have had a lot of cases, that Kentuckians have worked hard to protect one another. That those who have family members that have pre-existing conditions that would make them more susceptible to this virus. And remember, our population has more of those pre-existing conditions than just about anywhere else. Have worked very hard to protect their loved one and those that are suffering from those conditions. I think have worked very hard to stay safe. But I think a significant driver is our healthcare system and decisions that were made before. If you look at states to our south where the death rate is higher, they did not expand Medicaid, which means fewer people in their state have general access to health care, see a doctor regularly. I believe the expansion of health care and all the steps that we've done to provide access are absolutely critical in where we are right now. So I believe things that we did, just believing that healthcare was a basic human right, and in many instances, some things my dad did, along with how our people have responded, and I think how our governments, that's us and state government and local governments, have responded. Then the last thing I'd say is, I mean, our healthcare folks have worked so hard, and their results have been so good compared to most. We've seen throughout this that access to healthcare is now the difference between life and death, and I believe everything in the past that we did to expand healthcare has saved countless numbers of lives. Corinne Boyer, WEKU.
Hi, Governor. In July, you said that hospitals had learned from the winter surge and were prepared for another. And then the Delta variant hit and hospitals became quickly overwhelmed. Now that we're moving into winter, what are hospitals expecting? And what is being done differently to prepare for a possible winter surge? Thank you.
Yeah, to be fair, we're still trying to get people well, as hospitals still have too many people. But I believe that preparation period is about to begin. I think we got to be humble. None of us know what we're going to see in the winter, and this thing hadn't acted the same season to season. The Delta variant, at least in my opinion, acted different than the Alpha variant. And everybody wants to say it likes this type of weather or that type of weather. Certainly it likes people in close confined spaces, and that's certainly more possible in the winter, that we'll have more people vaccinated and even boosted in the winter. Certainly I was asked by some governors that got hit a little bit later than we did, that if you could go back in time, what would you do before the Delta variant? And we would have worked with our regional hospitals, and they did a phenomenal job. But on being able to increase the level of care, go ahead and convert spaces to ICU spaces or expand them. Go ahead and get some additional equipment on site for our stockpile. Go ahead and purchase some things that we didn't previously have runs on. Very basic hospital equipment that would be needed in just about any state. In moving forward, making sure that we've got the ability to provide monoclonal antibodies, whatever next variant, they should be more effective than a lot of treatments that we've gotten. And to the extent we're going to have another big surge, consistently messaged from the start not to go to the hospital to get tested, set up testing locations. We really have them, advertise testing locations locally, especially in a different way. And the Guard will be ready to help again. They are now trained for this and provided critical relief. I think we learned through what the Guard could do well at hospitals, how we can free people up. The nursing students provided so much additional care, and having that ready to go. We were one of the first states to do it on the level that we did. And to think that started with a conversation at a picnic, appreciating our nurses. So to distill it all down, because we're good at distilling here in Kentucky, taking every lesson we've learned. We've never been through something like the Delta variant, and never. And I think it taught us where those extra reserves are that we can pull from. Now, I think we also have to address our nursing shortage that we had before this, and that could be done in a number of ways. We got to raise the caps that the Board of Nursing puts on our schools. We can train a lot more nurses, and there are a lot of openings that are out there. They're good paying jobs. They're all over. We could create 1,300 plus jobs in Eastern Kentucky right now by just graduating more nurses. I think we've got to make it easier for nurses and doctors, though we do a little bit better on doctors from other states, to be able to move here and begin practicing without a lot of hurdles. And I think we need to be more open to foreign-born nurses like we are to foreign-born doctors in different parts of our state. So I think those are all things that we can do and do a little more. I know that was a long answer, but with everything we've lived through, we certainly learned a lot about how to increase capacity. But the other thing that we will do is we'll get, and we do this regularly with the calls, all of our hospital systems and others together to talk about lessons learned and to make sure that we have the steps ready to go and ready to go more quickly, or maybe to be just a little more nimble. I think we now know in an exponential growth how quickly it can happen. All right, John Cheves, Herald Leader.
Governor, thank you. On the boosters, in August, the CDC director and other top health officials outlined a plan for all adult Americans to get a booster shot because we were told the vaccines were losing some of their effectiveness over time, over 6 to 8 months. And now we're told that only some groups should get the booster, those over 65 and et cetera, should get the booster. Other Americans are being told to hold off for now. Do we know what's changed in the last 2 months? And is there any plan, as far as you know, at some point for all Americans as originally planned to get the booster? So thank you.
I absolutely believe that at some point, all Americans will be authorized to get a booster. I think that we are going there. And I think that boosters are already complicated and there are multiple vaccines that are out there. And so the communication on it has been confusing and complex and difficult. And again, we're in the midst of a pandemic, making wartime decisions, trying to make the best communications we can. So that's not placing blame. It's just a third dose of a vaccine in this instance is more complicated. I think what it came down to is different groups balancing what's out there in different ways. I believe the president and his group said we got plenty of vaccine in the U.S. Eventually, everybody's going to need a booster. The Pfizer numbers show that it wanes over time and wanes for everybody. Let's get everybody boosted up and better protected. I get that. I can't wait until that's the case. And then you saw the FDA and the CDC said, wait a minute, to get to herd immunity, we need more people to get their first and their second shots. And to truly defeat this thing, we need to vaccinate people all around the world. And if you have, even if it's waned, if you have 70% or 60% protection instead of 90%, there are folks out there that worldwide at least can't get the vaccine that have 0%. So those are, those are all good people just balancing the challenges out there in different ways. My job is to protect the people of Kentucky. I want it as quickly as we can to be where everybody can get a booster. And if we need another booster in the future, to be able to get that too. My goal is everybody in Kentucky who is willing to get vaccinated, that we can keep their protection up at the highest level that they possibly can. I think that the fact that the president came out early, talking about one thing, and then this FDA and the CDC approved another. You could say that was a mistake in some way, or you could say that that's the system actually working through, and that in this instance, the president in pressuring or forcing the scientific analysis and an ultimate conclusion. But then the other side of that is there's public policy considerations in it too. So not easy decisions. Fortunately or unfortunately, not ones that I get to make. Our goal is just to have it ready, and 5 to 11-year-olds is coming, and it's coming soon for those first 2 doses. All right, that's our report today. Again, things are getting much better, but the level is still higher and too high. But the good news is it's coming down fairly fast. So everybody who's willing, hang in there. We don't see a whole lot of people wearing masks right now. It might not even be that much longer in certain places, but hang in there. Still a deadly variant out there, still not enough people vaccinated. But certainly the trends we are seeing are positively negative, which is a real good thing in this pandemic. Thank y'all.